Compulsive hoarding is a pattern of behavior which is characterized by the excessive acquisition of an inability or unwillingness to discard large quantities or objects that they do not need.
2 to 5% of adults suffer from clinical hoarding. This is 2 times the rate of OCD and 4 times the rate of bipolar and schizophrenia disorders.
The Diagnostic and Statistical Manual of Mental Disorders did not list hoarding as a mental disorder until 2013.
Factors that are often associated with hoarding include alcoholism, neuroticism, depression, anxiety, indecisiveness, perfectionism, vulnerability, impulsiveness, and self-consciousness. 18 to 40% of OCD sufferers display hoarding as a symptom.
Symptoms of hoarding include holding onto worthless items, homes becoming cluttered to the point where many parts are inaccessible or can no longer be used for their intended purposes, such as beds and bathtubs.
The clutter and mess often reaches a point where it can cause illness, distress, impairment, and danger to themselves and those around.
Different types of hoarding include animal hoarding. Animal hoarders own several pets, often without the ability to care for them. They're usually unaware that they are harming the animals. 78% of animal hoarders' homes are heavily littered with garbage. 45% have profuse urine or feces in the living spaces.
Bibliomania is another form of hoarding. Bibliomania involves the hoarding of books to the point where social relations or health are damaged. It is characterized by the collection of books which have no use to the collector. Often multiple copies of the same book are accumulated.
If you suffer from hoarding or know someone who does, some services you could contact include the Toronto Hoarding Coalition, Hoarding Help and Support, and the Toronto Hoarding and Extreme Cleaning Services.